Good afternoon, ladies and gentlemen. Welcome to One Utama, and of course, welcome to Focus Point 360 Advanced Primary Eye Care Roadshow. We are more than happy to have all of you joining us today. And today, right here at the Roadshow, we want to let you know a vision worth a lifetime. It is very important for all of us to take care of our eyes. And today, joining us today, we have our specialist, Dr. Nicholas Goh, our consultant ophthalmologist, sharing with all of you the common eye problems in children. Doctor, please introduce yourself.
Hi everyone, nice to meet you. I'm Dr. Nicholas from Isaac. Sorry, there's some problem with the speaker, alright.
But it's really our honor to have Doctor joining us today, sharing with all of us the common eye problems in children. So if you have children with you, if you are wondering what are the common eye problems that might be happening, feel free to just drop by here and listen to the sharing by Doctor.
Thank you. First of all, I would like to thank Focus Point for this wonderful opportunity to deliver a talk today. So I'll be going through the common conditions that we seen in children. So it can be refractive error, squint, red eye, eyelid disorders, lazy eyes, as well as I will touch on a certain important condition that not to be missed among children.
All right. So all these common conditions might be happening to your children as well, so you can really pay attention. All right.
Okay. So let's start off with a refractive error. It's actually a very common condition, and WHO actually estimates 153 million people worldwide have refractive error. But this information is actually outdated. Probably it was quoted in 2010. So what happens in refractive errors is the light rays that enters our eye doesn't focus on the retina properly, and thus it produces blurred images. So a small subset of children with refractive error, less than 2%, would have some degree of squint. It can be easily treated by correcting the refractive error. However, if it is left untreated, it can also lead to lazy eyes and result in permanent loss of vision in adulthood. So there are three types of common refractive error, which is short-sightedness, astigmatism, and farsightedness. So a study that was done in Malaysia in 2006, it shows that astigmatism is the most common form of refractive error, attributing to 22.2% of prevalence, followed by myopia, 13.4%, and hyperopia, 2.9%. Okay, so what are the signs and symptoms of refractive error? So actually for children, some of them may be too young and it's difficult for them to tell. They might complain of blurring of vision, either far or near. But visual cues is important to suspect whether a child is having a refractive error. So some suspicious could be like when you see a child sitting too close to the television or holding the gadgets too close to their face. Or if they complain of headaches, tired eyes, or they constantly rub their eyes. Or if you notice any abnormal facial turning when they focus at a far object. So this could be a sign of that the child is having a refractive error. So the first part will be on short-sightedness or myopia. So it's actually a condition whereby a child is able to focus near but unable to see distant clearly. So why does this condition happen? So in ordinary eye, in myopic patients, the eyeball is longer than ordinary eye. So this results in the image focusing in front of our retina and thus leads to blurred image when they see far. So this condition tends to run in family. There's a mode of genetic inheritance. With each parent having myopia, it increases the fold of myopia in inheritance by 3 times. So if both of your parents have high myopia, this increases the risk of having myopia by 6 times in your children. So normally myopia starts to develop by the age of 6 and it rapidly develops until the age of 13, and then it will slow down and stabilizes by the age of 20. So why is myopia important? Because as published in the Retina Today in 2019, it is recognized as a global epidemic. So the prevalence of myopia has increased in the recent years. So in after 2010, it was found that at least 1.9 billion of the world population has myopia, and it's postulated that this might increase to about 50% by year 2050. So it's increasingly alarming rate.
So by looking at the statistics, it kind of like vary, but have no worries at all. Because basically we have the specialist here today sharing with us like how we can actually tackle all the problem or how we can actually control the situation. Can we say that, Doctor?
Oh, yes. So don't worry, just bring them for an eye checkup. You'll be in good hands,
All right.
Okay. So the next topic will be about astigmatism. So astigmatism affects the near and far vision. Yeah. So why does this happen? In normal individual, the black part of our eye is spherical. It is round. So it creates curvature of similar length at different meridians. Yeah. However, what happens if your cornea is oblong or elongated, like the shape of a rugby? So it creates multiple curvatures of different lengths. Yeah. So this created multiple focal points in our eye, and this result in a blurred image being formed. Yeah. So, however, astigmatism is a very common condition. Most of us have a small degree of astigmatism, and it doesn't bother our eye. However, it is more commonly found along with other refractive errors. There's a small subset of astigmatism that may progress, which is known as irregular astigmatism, and it is not able to be corrected with glasses. So this subset may need to continuously monitored under eye care because it can be due to other corneal pathologies that can progress over time. Yeah.
So that's why it's very important for us to, to check it out and then to find it out earlier, right?
Precisely, yeah. Okay, so for the third segment of the refractive errors will be on long-sightedness, or in other words, hypermetropia or hyperopia. So this is a condition whereby a child have problems seeing near. So why does this happen? Because in our ordinary, in hyperopia eye, the eyeball is shorter than ordinary length. So this results in an image being formed, focused behind the retina. And therefore, they are unable to see near clearly, but they are able to see far. So this condition is actually common in children before 6 years old. However, our eye, as it grows, there's actually a physiological process that corrects this condition, which is known as ametropization. So by 6 years old, normally the hyperopia will reduce to near neutral. However, if it persists, it is possibly going to persist through adulthood. Yeah, but however, hyperopia can be easily corrected with glasses. Yeah. So it is less common compared to the other forms of refractive error. There's also a slight mode of genetic inheritance.
All right, okay.
Yeah. So why is it important to assess for refractive error? Number one, refractive error can be associated with screen. And this condition can mostly be corrected by just correcting the refractive error. Yeah. So number two, it is important to detect whether the refractive error causes any lazy eye. Because if it is undetected and is untreated, it may carry on to adulthood with a permanent visual loss. And this will ultimately affect their career pathway. So number three, why is it important to have our child, to provide our child with good vision? Because they are at their learning age, yeah. So you want them to perform well in their studies, to perform well in their school, so that they can have a better career in their future life, yeah. So this to assure that there's no interruption in their learning capability during childhood, yeah. And right now, there's a global recognition of increasing in the epidemic of myopia worldwide. Yeah. So there's a strong role of myopic progression. The mainly important is to prevent future complications. Yeah. Okay, so this is a chart to show that what are the complications that can be caused by myopia. So among them, myopic complications will be like increases the chance of developing glaucoma, accelerates cataract formation, increases the predilection for retinal detachment, as well as myopic maculopathy. So this chart shows that a lower myopia has lower chances of having these complications. But what happens if your myopia goes beyond normal?
Yeah.
Beyond 700 is a pathological myopia. So the fold of retinal detachment increase up to 44 times. Yeah. So this increases the risk of myopia greatly. So so you can see the benefits of controlling myopia and to prevent progression, so that all these complications does not happen to them in the future.
So we might not know, like, maybe I'm just having myopia, but we doesn't know that it might, cause further other complications to the eyes.
Correct, yeah. So it's important to have an eye checkup from time to time. Yeah. Okay, so these are certain advices to reduce the incidence of myopia. So some lifestyle modification can easily be done. We can be mindful of our screen time. So WHO actually advocates children below 1 year old. It's not advisable to expose them to any screen time at all. But children from 1 to 5 years old, it is advisable to limit the screen time to less than 1 hour per day. For above 5 years old, there's actually no recommendation, but general consensus among ophthalmologists is to keep it below 2 hours per day. Yeah. So, and recent studies have shown that you spend more time outdoors with exposure to light, it actually helps to retard myopia to a certain degree. So from the studies, it shows that just 2 hours per day spending outdoors, you can decrease the rate of myopia by 15%.
That's quite a lot, right? 15%.
Correct, yeah. And it's like a protective effect, a natural effect. Yeah. Yeah. But however, take note that the study also highlighted that those who already have myopia, it may not work very well for them. So from the study, it shows that cumulative hours outdoor, up to 4 hours, there's increasingly benefit in control the myopic progression, as well as the rate of elongation of the eye. Yeah. So these are the benefits of bringing them outdoor. Yeah. Okay. And nowadays, because we are spending more hours during near work, longer education time, longer tuition time, and also the advent of the use of multi-social medias, to enhance our learning. So a lot of screen time. So near work is actually strongly correlated with myopic progression. So it's important to be mindful about how much time your child is spending doing near work. It might not be possible to alter their education time, but it's actually possible to alter their rest time. Yeah. So if possible, we advise you to have take regular breaks in between. Apply a 20-20-20 rule, whereby you can stop every 20 minutes, just look far away for 20 seconds, 20 feet away. This would actually relax your accommodative muscles, relax your eye, so that you don't have a strong stimuli from the near work. Yeah. So it reduces the eye strain on the eye as well. Yeah. So apart from that, it is also more healthy to set up screen-free zones at home. Yeah, screen-free zones you can set up at the dining hall. Yeah, so during your lunchtime and dinner time, just take a short break from gadgets. Yeah, this will promote social interaction, healthy development among your family members. Yeah, it's beneficial to your child. Yeah. So to enhance, to reinforce all these, parents have to play an important role. Yeah, you cannot be hiding one corner and playing phone. And expecting your child to follow that. Yeah, so you have to enhance that by being a role model. Yeah, so you have to practice that strongly, strictly.
So starting from now, we're gonna set a 20 minutes timer. Every 20 minutes, you're gonna stop for a while and then look far, rest our eyes for for more resting, for the kids and for the parents too.
Yes, that would be beneficial for the eye development. Yeah?
All right.
So what happens if their normal lifestyle strategies doesn't work? There are actually certain myopic control strategies that can be considered in patients with high risk factors, like both parents having myopia, or patients with already have a high myopia, you want to slow down their progression, or those with high, strong suspicions of developing myopia. So certain control strategies would be like atropine, diluted atropine 0.01%. So studies have shown that this medication can retard myopia by at least 50%. Yeah? However, there's a small group of patients who don't respond well to this medication and therefore might require other forms of strategy. But the advantage is that it is very easy to employ. It only requires 1 drop per day at night. Yeah? So the compliance rate is very high and the cost to start this treatment is very low compared to other forms of treatment. Yeah. So apart from that, there are also special contact lenses. Yeah. So there are contact lenses like Ortho K that's able to reshape the eye and create a blur zone at the periphery, and this is shown to slow myopia by 55%. Yeah. However, the limitation is that the compliance rate among children is not so great.
Yeah.
And this increases the risk of corneal infection, maybe 1 in 3,000. Yeah. So, but the advantage that it carries is that they can be spectacle-free the next morning, yeah, and this would also improve their performance in sports, yeah. But otherwise, it is more costly than atropine. So apart from that, there's also defocus spectacles with a special lens, yeah. So this shows to have a better efficacy of 50 to 60%. However, because of the defocus zone, it compromises our visual quality. So the alignment of the glasses is very important. However, because the child is depending on the glasses to correct their refractive error, and therefore the compliance rate is very good. Yeah. So the efficacy is actually not bad, 50 to 60%, but the glasses can be quite costly. And there's a new technology that helps to retard the progression of myopia even further, which is a low red light therapy. So by providing low red light stimulus to a child for 3 minutes, twice a day, 5 times a week, it does help to improve the choroidal circulation, and it also reduces the elongation and myopic progression by 70 to 80%. Yeah. So for this therapy, there is a high compliance, there's high efficacy, and studies have shown that those who are very compliant may even reverse their axial lengthening. So this is also possible. However, there's a small group of super responders who might not respond very well to this treatment, and therefore we might need to monitor as well. Yeah. Okay.
So it really depends on the kid's lifestyle, how they comply to that specific method lah. It depends on which one they can comply more. So it's like better they go to the ophthalmologist first, right?
Correct, yeah. If they do not conform well to a certain strategy, we can always combine or change strategy, yeah.
Oh, we
So
can
it's
combine as well.
Correct. So it's important to monitor their progression, yeah, from time to time. Okay, so when is the right time to refer when you suspect of refractive error? So when there's any visual complaints like blurring of visions, or you notice any special visual cues, like there's a special head turn, or your child is making a lot of mistakes in their homework, not copying down the information correctly, or teacher starts to complain that your child is not paying attention to school. So that's the best time to bring your child for an eye checkup, yeah? Who knows, they might be having refractive error, they might not be seeing well. Yeah?
Not because of their attitude.
Yeah,
Alright.
sometimes it's not because of their attitude. Because children, when they are too young, they might not be able to explain very well. And if both eyes are having refractive error, they might not be even aware that they are having refractive error in the first place. It might be a norm to them. Yeah.
So it's very important for the parents to really take good care and monitor their kids first.
Correct. Correct. Yeah. Okay. So second part of my presentation will be about squint. Yeah, squint is defined as a misalignment, or basically is your eye muscles are not coordinating well, so they are not moving together at the same time. Yeah. So based on certain classification, we can divide squint into their direction, manifestation, whether is it alternating, and the cause. So to put things simple, I just show you a picture. So based on the direction of the squint, you can have an inward squint or outward squint. So inward squint is esotropia, outward squint is exotropia, upward squint is hypertrophia, downward squint is hypotropia, yeah? Based on the direction of the squint. So there are squints that can be controlled well by the children as well. These are intermittent squints. Yeah, so most of the time it is it appears on certain conditions when certain conditions are met. Like for example, when they see too far or too near, the squint may appear. But these conditions can be trained so that they improve their control, and it doesn't appear most of the time. Yeah. Okay, so there are squints that can be fully corrected with glasses or partially corrected with glasses due to refractive error as well, due to the commutative issues. Yeah. Okay, there are squints that can alternate. This is mainly because they lost their binocular single vision, so both eyes are not be able to use to focus at the same time. So our brain suppresses one eye, and therefore they can only use one eye at a time. Yeah, this is to prevent double image formation. Yeah. So why is eye assessment important for squint? Because we want to rule out conditions that can be easily treated, like refractive error, and we also want to prevent lazy eyes, because lazy eyes can actually be carried to adulthood and lead to permanent visual loss. Yeah? So it is also important to detect secondary causes that can be life-threatening, that can be sight-threatening, like eye cancer or space-occupying lesion that you might need urgent attention, yeah? Especially cases where there's sudden onset of squint. There are also cases whereby squint is associated with a systemic condition like Down syndrome or maybe Duane syndrome. Yeah, so yeah, you might want to detect that as well, because they might have other systemic implications. Yeah. So by assessing the squint, we can also assess the binocular single vision, and therefore we can decide whether early treatment will help to preserve that, yeah, or they already lost the treatment and therefore doesn't require an urgent treatment. Yeah, so this will help to make decide on the decision making on the time of the treatment. Yeah. Okay, so when is the right time to do an eye assessment? So babies too young, less than 3 months, normally have some form of intermittent squint. Now this is because their eye muscles are not coordinating properly. So, but normally after 3 months, their muscle coordination improves, and if there's any persistent squint, it might be significant. So at that point, it's important to send your child for an eye assessment. Yeah. So whenever you suspect your child have a new squint, it's also an urgent indication to be assessed. They might need some imaging. Yeah. And also, if there's a strong family history of squint, any suspicions like visual cue, abnormal head position, you might want to send them for a squint assessment. Okay, so what are the importance of early treatment? So like I said, we want to preserve their vision. We want to treat amblyopia so that their adulthood vision is good. Yeah? So we also want to preserve their binocular single vision, which is important for their 3D, their depth perception. This would also ensure that they have a better future career pathway. Yeah? We also want to identify and treat urgent causes, like any space-occupying lesion or eye cancer, because it can be life-threatening apart from sight-threatening. Yeah. And cosmetic correction is also important in children. Why is that so? Yeah, because they are growing, they are socializing. They may have some point of social stigmata in their life, and this helps in improving their self-esteem, their confidence level, and also their psychosocial development. Yeah, so it's important to get it treated early. So what is pseudosquint?
Yeah.
Anyone have any idea? Yeah.
The name itself is very, very, very technical.
Correct. Yeah. So pseudo actually, as the name explained, is a false lah, and then squint is a squint, strabismus. Yeah. So pseudosquint is actually a false impression of squint caused by certain conditions. Yeah. So sometimes the child may have a wide interpupillary distance, but the eye is straight, so it may look like the eye is turning inwards. Yeah. Sometimes they have a large angle of kappa. Angle of kappa is formed between the pupillary axis, the midpoint of the pupillary axis, and also the fixation point. So this will create a false impression of squint. But otherwise, this condition doesn't require any treatment because it's actually normal. Yeah. So we might just need to monitor their visual development.
All right.
So the next part of my presentation will be on red eye. Yeah. So what are the common causes of red eye in children? So it's commonly caused by viral infection, bacterial infection, and even allergic conjunctivitis. But take note, there are also not so common conditions that can be sight-threatening, like corneal infections, eye inflammation, uveitis, and also cancer. Okay. So it's important to get your son, your children for an eye checkup if there's any red eye. Yeah. So conjunctivitis can also affect a baby during their first month of life, and they have a special name to it, which is known as ophthalmia neonatal. So it is likely that the infections is carried by from organisms passed on from their birth canal. Yeah. So this condition has to be managed in hospital-based setting with a pediatrician because there's a risk of systemic dissemination of the infection because of the immature immune system in the neonate. Yeah. So normally it's treated with topical and systemic antibiotics. Okay, so viral conjunctivitis actually is a very common condition. It is extremely contagious. I'm sure you might have your whole family been infected with conjunctivitis before. Yeah. So children commonly present with red, watery, swollen eyes. It is a self-limiting condition, normally resolved by 2 weeks. So if let's say it is a mild condition, only artificial tears are required to treat this condition. But however, if it is severe, you might require some antibiotic coverage to cover for secondary bacterial infection, and also maybe some steroid if there's any formation of pseudomembrane or either nummular keratitis that affects their vision. So bacterial conjunctivitis is not as common as viral conjunctivitis. Yeah. So a child normally presents with red, swollen, yellowish, sticky eyes. Yeah. So it's a self-limiting condition. Yeah. That resolves normally by 2 weeks. Yeah. So it's normally treated with antibiotics and artificial tears. So steroid may worsen these conditions and has to be avoided. So for allergic conjunctivitis is a fairly common condition. It is due to hypersensitivity reaction in a person. Yeah. So whenever they are exposed to allergen, the hypersensitivity reaction will mount and they develop allergic eyes. Yeah. So they normally present with red, swollen, itchy, watery eyes. Yeah. If let's say they are associated with multiple systemic allergies, such as allergic rhinitis or maybe a severe skin condition, they might require some special tests to identify those allergens. Yeah? So allergic eyes are normally treated with antihistamine, mask stabilizers to control the condition, artificial tears, and steroid if there's any acute flare. Yeah. So we have to educate the family and the children properly for lifestyle changes, to start using their eye drops, to stop rubbing their eyes, and to avoid allergens so that you do not have a future allergic attack. Okay, so general care for red eyes. Okay, one, we can employ frequent hand washing with soap. Yeah, this is to prevent harboring germs on your hands, and also please refrain from touching your eyes or rubbing your eyes regularly. Yeah, this is how the germs are transmitted to our eyes. And once you have conjunctivitis, we advise you not to share your towels, your fabric, your pillows with your loved ones because you might cause an outbreak at home. And we advise you to have a rest at home. Yeah, because you don't want to be the culprit for the outbreak at school or at work. Yeah, and it's advisable not to share your eye drops with anyone else. Yeah, especially your artificial tears. You know, like some old people with dry eyes might want to use your eye drops. You will have to stop them. Okay. And if you have red eyes, it's advisable to avoid using contact lens. Yeah, for at least 3 weeks. Yeah, this to prevent corneal infection.
But the good thing is, like, you know, after we have seen so many pictures of different eye sickness, right? The best thing is it can be treated.
Correct, yeah. So if it's detected early, most of it can be treated. So that's the importance of sending your child for an eye checkup early.
All right.
Yeah. So there are other common causes of lid disorders in children, such as eyelid infection, droopy eyelids or ptosis, and also tear duct obstruction. So for eyelid infection, the common presentation will be preceptor cellulitis. So it is known that 80% affects children, and is commonly caused by common bacteria like Staphylococcus aureus and Streptococcus. And most of the time, we can find a local source of infection, like infected chalazion. And children normally present with swollen, red, painful eyelids and droopy eyelids. Yeah? So this condition has to be treated with topical and systemic antibiotics and have to be closely observed. Why? Because children below the age of 4 years old, their septum is not fully developed. So this condition spreads rapidly and can be complicated into orbital cellulitis. Yeah? So orbital cellulitis is where the infection starts spreading into the orbit. So it can be potentially blinding, it can be life-threatening, it can spread to the brain as well and cause an abscess. Yeah? So these conditions require hospitalization, requires intravenous antibiotics and also topical antibiotics, and has to be co-managed with a multidisciplinary team. Yeah, and sometimes there's a need for surgical intervention if there's any abscess formation, whether it's an orbit or the brain. Yeah? Okay, so for droopy eyelid, it can affect one eye or both eyes, but most of the time in children is due to congenital cause. They are born with it, with a poor developmental of their elevator muscles. Yeah, but sometimes it can be caused by injury, also eye infection. Yeah, so most of the time, patient with droopy eyelid would have abnormal head position, whereby they have to lift their head in order to see better. So why is that so? Yeah, because our eyelid is actually blocking our visual axis. So by pressing on the visual axis, sometimes it causes some degree of astigmatism as well. So if this condition is mild and not threatening their sight, it can be simply treated with corrective glasses and observation. However, if it is moderate or severe, affecting their vision, threatening their vision, they might require surgical intervention early. Yeah? So the third part of this will be on nasolacrimal duct obstruction, or it's known as tear duct obstruction. So actually it's a very common condition, normally seen especially in the preterm, yeah, whereby there's a delayed cannulation of the tear duct. So the child will normally present with watery, yellowish, sticky eyes, but the eyes are white, yeah, because there's no infection, yeah. But don't worry, 90% of the time it resolves by 1 year. Yeah, so normally if we see these conditions, we would advise parents to do some eye massage. We call this cricketer massage. So the whole idea is to place the index finger at the medial canthus and to do a downstroke, maybe 10 times per rep and do multiple reps per day. So the idea is actually to stretch the nasolacrimal duct so that it tears, it perforates early. Yeah, so you have to clean the discharges regularly as well, otherwise there's a risk of eye infection. So antibiotics is normally reserved when there's any signs of infection. And then if let's say by 2 years it is not responding well to conservative management, we might consider some surgical intervention. Yeah? Okay, so finally about lazy eyes. Yeah. So lazy eye is also known as amblyopia. So actually what is lazy eyes? Yeah? So it's actually a condition whereby there's reduced vision due to the disturbances in visual development. So the golden period for visual development is the first 8 years of life. So anything that prohibits a clear vision or disturb the vision can cause lazy eye, yeah, like refractive error, high refractive error. Yeah. So lazy eye can also be carried on to adulthood, and this would lead to permanent reduced vision in adulthood, and it may not be reversible. Yeah, so it's very important, has a strong implication on their career pathway. Yeah. So severe lazy eyes can also be associated with squint, yeah, but not necessarily if their vision is good. Yeah. So lazy eye is actually the condition caused by many other diseases, yeah, such as any disease that prohibits clear vision, like for say congenital cataract, or either refractive error, like too high power, different power in both eyes, or either severe high angle squint, or even ptosis that covers their visual axis. Yeah. So what are the signs of lazy eye? Yeah. Similarly, like refractive error, the child may look normal, but you need to look for visual cues. Let's say if they prefer to use one eye to do things, to look at things, it could be a sign that the other eye is not so good. Yeah, and when the child is too young, it's difficult for them to voice, and sometimes they are born that way, they don't realize. Yeah, so what we can do is we can download this app, which is a rapid eye screening test, which was developed by Dr. Chan from Isaac. Yeah, so it's available at Google Store and also Apple Store for free. So you can use it to do a simple eye screening at home before you decide to send your child for an eye checkup. Yeah. So what are the strategies to treat lazy eyes? Yeah. So it is best treated within the 8 years of life. But recent studies have shown that it is so beneficial to treat up to 13 years old. Beyond that, the treatment effectiveness is a bit modest. So first we need to screen for any other conditions that prohibits a clear vision, like for say a cataract or maybe a high angle screen. So you want to get that treated. And then if there's any refractive errors, we want to get them treated as well. But if the best corrected vision is not so good, then we start to train your eye with patching. So we cover the good eye to force the worst seeing eye to see more. Yeah. So this is to provide more visual stimulation to that eye for it to develop further. If they are not so compliant, we can also employ the usage of atropine 1%. This would blur the better eye so that they use the poorly seeing eye more often. Yeah. So there are other forms of dioptic treatment that enhances binocular interaction with various platforms, such as VR devices, even streaming devices. Yeah. So studies have shown that the efficacy is so much better compared to the others. Yeah. Okay. So a condition not to be missed among children is white pupil. So what exactly is a white pupil? So when you take family photos or when you flash some light, yeah, so there's actually a reflex from our retina. The normal color would be red, yeah. So but if you see there's a whitish reflex in your family photos, please be alerted because a condition of white pupil normally is associated with poor vision, yeah. And there are certain conditions that can cause white pupil, like mild one like cataract, or even eye cancer, retinoblastoma, or even eye infection, yeah, retinal infection, or even abnormal structure of the macula. Yeah, this is congenital. Yeah, so we might want to do an eye checkup just to rule out eye cancer because it is life-threatening and also sight-threatening. Yeah, okay. So this is my take-home message lah. So in the summary, when do you want to get your children to go for an eye checkup? We advise to send them to an eye checkup before they start formal school. Yeah. So whenever you have any doubts or concern, please do consider to send them for an eye checkup as well. And if they complain of any symptoms such as headache, tired eyes, they rub their eyes a lot, or if you see any signs of infection or ptosis, or screen, please bring them for an eye checkup. Yeah. So this is my take-home message. Yeah. So I hope everyone benefited from the talk today. Yeah. Thank you for the opportunity.
Thank you, doctor. Most importantly, we're going to access the eyes and detect it early so that we can treat it accordingly, right, doctor?
Correct.
All right. Any special last words for the audience?
Take good care of your eyes. Have ample rest. Spend more time outdoors. Yeah, and get your eyes checked out from time to time.
All right. Thank you, Dr. Nicholas, our consultant ophthalmologist. Thank you so much for being here with us, sharing on all the knowledge, the common eye problems in children. Most importantly, get it detected, and we will help you accordingly. All right. Thank you, doctor.